we see, and this is kind of why the work that I do and got into working with children and adolescents is that when we can start younger, that, the brain mechanisms that kind of form in our brain, they become, stronger and stronger as we get older. And so when we can start with someone younger and start treating them with different coping skills and helping them manage, that they are then able to kind of take that through the whole lifespan. And, you can kind of prevent some more serious mental illness and be able to help people younger.
What we're really looking for is getting to know how they think about the world and how they think about themselves, how that influences their emotions, their interactions with other people, their relationships with other people, both their family and their friends. And then we're looking for their strengths, right, where we can capitalize on that, but then also areas that maybe they need a little extra support.
So we are incredibly excited and grateful for Delaware North for donating $150,000 to support starting an inpatient psychology program. When children are admitted with either a life-altering trauma or a new diagnosis of a chronic illness, or if a mom or a father has a child in the NICU for a long period of time, or has some other illness that's very challenging, there's a significant mental health impact on that. And we want to make sure we have the ability to start treating that mental health impact right away the minute they're admitted. And so one of the challenges we've had up until now is that reimbursement does not provide for reimbursement of an inpatient psychologist, which is why we rely on philanthropy to support that person. The goal is to grow this program from one to several inpatient psychologists so that every child, every sibling of a child admitted, mom who's admitted, or a parent who has a child in the hospital has access to these services.
I think that the best part about working with kids is that they're still learning and they're still growing. So when they're able to get these skills at a younger age, they're able to implement them for the rest of their lives. And a lot of times when we get a certain behavior, we get stuck in that pattern. So when we've been doing this pattern for our entire lives, it's a lot harder to disrupt that pattern with some more healthy skills than when it is as children. So we're able to kind of get the ball rolling with those skills and they could keep using them into their adulthood.
When we have months like this, like Mental Health Awareness Month, or we have Suicide Prevention Awareness Month, this can really shed a light on the struggles that people are going through every day. And I hope it helps people feel empowered to share their story, because then the more we're talking about it, the more other people are more comfortable talking about it.